On February 17th, I believe I emailed Tim Brown saying, hey, I heard that supply chains are being disrupted by this coronavirus in China. Is that going to affect us?
I think it was the second weekend in March, and I'm like, okay, so I'm watching the statistics, how many people get infected, how fast they get infected. I'm running patient lists. How many patients could this potentially mean? It was just crazy. I had data overload, and I'm like, well, if it really replicates this fast, we could have this many people in the hospital, and I'm emailing Al this, and I'm like trying not to panic. But knowing we were already looking at, did we have enough PPE to even do this?
Bob called us all crazy. He's like, you're crazy. And luckily, he was kind of right for all our own sake now that those numbers didn't live up to it.
John, you probably remember this, recording all the COVID possibilities because of the matrix grid of doom and gloom that we're going to have probably 2 workers answering phones. So we had these, John recorded these messages. I had about 3 tiers, and who's going to get these and who's going to answer and where is it going to go? This big grid going on, kind of what Al's talking about of how we're going to make this work, because
that was driven by me.
Around. To asking people to bring in their iPads because we're getting everything turned to telehealth, and we had no iPads, and everybody was buying iPads left and right, so we couldn't buy any iPads. So we were borrowing from anybody and everybody to make that work.
Remember when we locked the doors for visitors? You know when that was?
I think go ahead, Emily. I was
going to say the 10th of March as well.
Was it? Okay.
I'll never forget that. I waited till the end of the day, and then I remember thinking, like walking to my car, we're literally locking children away from their parents, you know? And I remember just crying on the way home, and I thought, well, this will last a few weeks. Like, it'll be okay. Well, a year later, you know. And I remember Dave saying in a meeting, be prepared to deliver care like we're in a third world country.
Mm-hmm.
And I remember thinking that when we were putting up our COVID unit.
Oh my.
Putting up the walls and stuff, and sweat was just dripping through my N95 and my gown, and I couldn't see anything, you know, and I remember thinking, here we go. And I remember doing I think it was Skype with one of our residents in memory care who was passing away with his wife who lived in catered living. And we said she could come to see him, and she didn't want to, but we knew that it wasn't going to be long before he passed away. So Nicole Wood brought a laptop to the wife, and I brought an iPad in to the husband. And I just get emotional even thinking about it. I mean, just how, it was so awful. And I just thought, really, is this really and truly happening? Like, wake me up, you know? Because we had families outside too, and yeah, it was, yeah, it doesn't seem real, you know, those things happened.
You know, we were all in survival mode at that point. And,
absolutely.
And, you know, we're just thinking, how do we get, you know, how do we plan for this?
Well, I just remember about a month ago, maybe a little over a month ago, Kirsten and Steve and I were in the hub, and we kind of all just looked at each other and said, what was our job? What did we used to do? No.
I was scared after our outbreak that we would lose a lot of our staff, you know, that they would just be done.
You know, we obviously had COVID cases, but there was no COVID shaming. You know, that's one nice thing I love about this organization is that everybody pitches together and works together, and there was none of that, which I'm glad that there wasn't.
I think I was kind of telling Dave, what are the things that we appreciate now that because of what we've gone through, what do we look at differently? What do we know we can do differently? Or what things did we lose that now we appreciate, or what's the one thing we miss most? I mean, we probably all have some of the same answers, but who would have thought we could do a drive-through clinic or a respiratory clinic out the back door, or the things that we've done that a year and a half ago we would have scoffed at. As a team, we've pulled together. I've seen more teamwork, effective teamwork in the last year, probably than consistently ongoing than I ever have prior to being here.
Yeah, it was at the beginning a lot, but like everybody said so far, I mean, we're all team, but it's almost like we're all family too, because this is all the stuff we've been through. It's definitely brought us a lot closer knit group.
But I was going to say the family, the tight knit, it drew everybody together, very supportive. Our core staff on the floor being so resilient on our day-to-day changes all the time. We changed it from yesterday to today, and just going with the flow and not questioning all the changes that were happening. It did develop a family at Fairway View.
I've become more resilient. I've become more creative. My team's become more resilient, more creative, and at no point did anybody say we can't do something. And I think that's what I'm the most proud of, is that there was nobody who stamped away, mad, angry. If they didn't think a workflow would work, they'd come back with a solution. And I think it made everybody be a little bit more creative about how we deliver care and how we meet patients at a different level than we ever have.
For me, one of the things that I'll always be grateful for, and one of the things that I'll always remember that still surprises me through all of this, is when we were dealing with the outbreak here, how phenomenal our families were. Like, you'd call a family and say, I'm sorry, your mom, tested positive this morning. And they would say, how are you doing? How's the staff? It was just unbelievable. I mean, how after residents passed away, families are still calling us saying, how is everything going? How are you? Or if their loved one passed away, is so-and-so still with us, or how are they doing? Or, those kinds of things. I wasn't expecting that. And I think that reception and support from families is what kept us going and what kept the direct care staff going. Knowing that, I just get emotional about the whole deal. Just knowing we were making such a difference, and it was really and truly noticed by those that mattered the most, so I'll stop.
So it's crazy how what we experienced right up front, what took many months for us to experience, and then it was awful. And then here we are right now looking back on what wasn't even a year ago now, just the range of emotion that we've all of it experienced at work and at home in the last year is amazing.
And I think one of the emotional parts that I had just recently was our first Walgreens vaccination clinic that came to Ortonville. Just like that took me down. That was very stunning.
Oh, that was. I remember Cindy and I standing there as those carts rolled down the hallway, and those pharmacists are looking at us like, why are you guys tearing up? We all remember it was 12 to 18 months out from March of 2020 that they were telling us to maybe expect a vaccine, and here we are now.
Giving the vaccine at Fairway View makes me want to tear up just like Emily did. Though it was just so exciting. It was Christmas for so many people. The logistics behind the COVID vaccine is an absolute exhausting nightmare. It's so much all the time. Just yesterday, today, tomorrow, next week, we cannot figure out an efficient way to do anything, it feels like, because they changed the rules.
The biggest thing I have felt and I have seen is how everybody just really drew together here and looked for solutions, and it wasn't somebody trying to run the show, and I've been so impressed with that. And just thank you to each of you for everything that you've done to work in your areas and to help us do what we needed to do too?
It was a lot of learning on the fly and just adapting. And I think we're all doing a lot of that, was just adapting as we were going. And
I said earlier on in this pandemic is working with each and every one of you. I couldn't have had a better team to work with. I enjoyed working with each of you guys, and love you guys all from the bottom of my heart. And it's great to fight this war with all of you working together.
So I am very, very thankful, especially for you, Dr. Al, who's been open-minded to some of this stuff, and our team who has really been willing to look outside the box and make things happen, because I'm seeing a lot of places where it is not, locally.
I want to recognize Dr. Al for all of his work in this COVID. I can imagine going through this with any other medical director. So thank you very much, Dr. Al.
I think because of our physicians, because they took it serious, because we took it serious, and that a lot of it meant doom and gloom and talking doom and gloom and warning everyone that the sky is falling. This is all anecdotal, but when you look at our county's numbers, when you look at Fairway View, I think we saved lives. Our organization and Dr. Al, Dr. Stacy, Beth, and then using John's talents of communicating, got out there, talked about it, and saved lives and convinced people that it was real.